China's on the cusp of something both welcome and risky. The largest annual migration in the world. Hundreds of millions returning to their often rural homes for Lunar New Year. Strict COVID policies shut the travel down for 3 years. But as China loosens rules, it's back. And so's COVID. Cities ravaged first. China's official numbers show 60,000 COVID deaths over 5 weeks of outbreak. But that only includes death in hospitals. And something's off with the math. Peking University estimates 900 million people have the virus now. Even a conservative fatality rate of 0.1% would mean the true death toll may be closer to 1 million. So how do you get to the truth? Between social media images of packed funeral homes, there is satellite imagery of crematoriums suddenly building enormous parking lots. Then there's this man, Li Wenliang, the whistleblowing Wuhan doctor who first told the world about COVID. 3 years ago this week, he was becoming gravely ill with COVID and died soon after. Ever since, his Weibo account has become a type of shrine. Even today, people still comment under his warning to the planet. Their posts, personal, sometimes wrenching.
We still can't get mRNA vaccines at Paxlovid. Without those good medicines, I feel angry.
3 years ago, you said the virus was coming. They didn't believe it. Right now, everything proves that was true. It's not only people who are getting sick, the country is sick.
And so now, the Lunar New Year, all those people on the move, is COVID on the move with them as they head deep into the countryside? What isn't China telling the world about what's really happening? So this is where we need the help of Emily Feng, an international correspondent with NPR, who's reported from China, has seen this situation firsthand. Emily, we talked about how the COVID death numbers just aren't adding up. How off are those official numbers?
The official death toll is 60,000 people. And if you do the math, that means about 6 in a million people are dying. Compare that to the global average, which is about 3 out of 1,000, and there's a massive disparity there. Now, China did have the advantage of going through this surge with most of its population vaccinated, though many of their elderly above the age of 80 were not. So they comprise most of the people who are unfortunately dying. But even with that bulk of vaccinations, that death toll is astonishingly low. And one of the reasons behind that is the way China counts COVID deaths. They need to go through a hospital committee. It goes through at least 2 rounds of screening. And people who have pre-existing conditions that COVID then made worse and perhaps led to their death tragically, they are not counted as a COVID death. Because hospital systems have been overwhelmed, ambulance services have also been overwhelmed as well during the surge, particularly in December. Many people were not getting to the hospital. They were dying at home. And so those numbers are also not reflected in the death toll.
Does China have all of the medication it needs?
Right now, they're still running short. Pharmacies are restocking, but their shelves were completely emptied by early January. What they're really needing is fever medication, pain medication, oral antivirals. Now, China has developed its own that's going through clinical trials and looks quite good. Pfizer also is able to sell Paxlovid, which is the oral retroviral that people take here in the US. But unfortunately, the volumes going to China just aren't enough. Online sites have been rationing how many packs of Paxlovid people can buy a day. They almost always sell out within a few minutes. For a couple of weeks in December, people were selling Paxlovid on the black market in China for literally thousands of dollars a trial. And this was something that most people couldn't afford.
So I suppose what's China's plan now?
Right now, the thinking seems to be, public messaging-wise, that herd immunity is the way China's leaders are going. They are now publicly listing out the infection percentage numbers province by province, with the idea that the more people who are infected more quickly means that the peak will pass. Of course, this has put a huge burden on the hospitals because so many people are getting sick at once. But there's no clear next step about what happens when, say, a new variant emerges. And the fact that so many people, 900 million, according to Peking University, were infected in the span of just a few weeks, that's a chance for the virus to replicate itself and to evolve into new variants, perhaps, that might lead to a second or third surge in China.
Awful. All right. Emily Feng, thank you very much for your time.
Thank you, Adrienne.